All right, welcome to the third installment of Scarrett Bennett's What's the Connection live conversation series. It's February 5th, 2016. My name is Carissa Dieter, and I work with the Education Department here at Scarrett Bennett Center as a Bell H. Bennett Fellow. Scarrett Bennett exists to create space where individuals and groups engage each other to achieve a more just world. One of the ways we engage this mission is through this series. The series brings together scholars, activists, artists to establish the connections between the events and issues we hear about on the news, our own real-life experiences and interactions, and the broader historical and social contexts that are so often overlooked by our reactionary media. Scarrett Bennett's first live conversation responded to the shooting at Emmanuel African Methodist Episcopal Church in Charleston, South Carolina, in the Black Lives Matter movement. Our second conversation addressed gentrification, displacement, and racial inequity in Nashville. In this, our third What's the Connection Hangout on air, we'll talk about Insure Tennessee. Insure Tennessee is a bill that would allow 280,000 Tennesseans gain access to health care coverage, save our rural hospitals, and bring over $1 billion of our federal tax dollars back to our state, all without using a dime from local taxes. Join us now for a panel discussion including local theologians, activists, artists, and educators in which we explore the connections between access to health care, racial, and economic justice. So our panelists today include Narcissa Haskins, Justin Jones, and Chris Coleman. I'll let them introduce themselves with this first question, which is, who are you and what brings you to this conversation? So we'd love for you to say your name, where you work, your position, any pertinent information, and why you care about this issue. Whoever wants to go first. Narcissa?
Hi, my name is Narcissa Haskins, and I'm work with the Scarrett Bennett Center, and I'm also a client advocate fellow at the TJC. I really care about this issue because thinking about people without access to health insurance really upsets me. I think that it is a choice between somebody choosing to go get help right away from their own doctors versus waiting until they're on their deathbed to go to the emergency room to get help. And so those decisions, those life or death situations will be eliminated and made better for people with Insure Tennessee.
Justin?
Hi. First, I'd like to say just thank you for having me today. And my name is Justin Jones. I'm a student at Fittest University. Also serve as chair of the Nashville Student Organizing Committee this year. And just one of the voices, many voices there are. I'm just humbled to be part of such a powerful movement of people from around the state who are speaking around this issue of Insure Tennessee, the expansion of health care. That's me.
Awesome. Thank you. All right, Chris?
My name is Chris Coleman. I am a staff attorney at the Tennessee Justice Center. TJC, where Narcissa is an intern, is a nonprofit law firm where we focus on issues where the basic necessities of life are at stake for our clients and where our efforts can bring about systemic change statewide. And though that mission is quite broad, our focus for the 20 years of our existence has been primarily on access to health care and the TennCare program, which is Tennessee's state Medicaid program. This has meant that we focus very much on the need to pass Insure Tennessee in Tennessee. The reason I'm passionate about this, outside of the reasons that Narcissa and Justin have already identified, is as a lawyer working with access to health care, there is nothing more painful than having to tell a client, I'm sorry, but you're just not eligible for this program. I know you need help, and I know it seems unjust and is unjust that you can't get it, but unfortunately, the program does not cover you, and you know, that nothing hurts more as a lawyer to tell your client there's nothing we can do.
Yeah. All right, thank you guys so much. We're very happy to have you. And just to continue diving right in, I want to hear more about your experiences working with Insure Tennessee. Just from your perspective, what do you know about the issue, and what experiences inform what you know?
I think maybe it makes sense for me to go first, just to make sure everybody's on the same page. Any viewers that understand what Insure Tennessee is, why we have this problem, and what Insure Tennessee is meant to fill. So, one piece of background that's important: Medicaid is, first of all, it's different than Medicare. Medicare is a wholly federally funded program for seniors and certain people with disabilities. Medicaid is a jointly federal and state-funded health program that's for low-income people. And most people think, okay, low income, if you're poor, then you must be covered. But to be eligible for Medicaid, traditionally, you had to be both financially eligible, you had to be low income, and you also had to fit into a certain category. So Medicaid, prior to the Affordable Care Act, covered pregnant women, children, certain people with disabilities, some parents of minor children. But if you were, say, a single adult, you were not eligible for the program, even if you had zero income. The Affordable Care Act was meant to remedy these sort of patchwork, which had lots of holes in it, to make sure that everybody below 133% of the federal poverty level, which is about, for a family of four, is about $35,000 a year, would be able to access coverage through the Medicaid program. For people who are above that 133% of the federal poverty level, the Affordable Care Act provides premium tax credits. It allows you to buy health care through the Obamacare exchanges and to get subsidies to help pay the premiums. And those premiums are available to people between 100 and 400% of the federal poverty level. So you had Medicaid that was supposed to cover everybody who was low income, and everybody above that would be on a sort of sliding scale to help to get subsidies for their premiums. And the idea behind this was everybody who's legally in the country. There is a large exception, and I think troubling exception, for undocumented people, but the idea was that everybody should have access to some coverage. Well, the Supreme Court then ruled that Medicaid expansion could not be required of the states. That states had the option to do it or not do it. So at this point, Tennessee has decided not to do the Medicaid expansion, which is Governor Haslam's model for this is Insure Tennessee, so that's what we'll call it. And what this has created is all of those people who fell through that patchwork, single adults, adults with children above 18, even if they're low income, they still can neither get premium tax credits, because those are only available to people between 100 and 400% of the federal poverty level. Mm-hmm. And they're not eligible for Medicaid because we didn't expand the program to cover those categories of people who are not under the traditional program. So still low-income children are covered, pregnant women are covered, parents of minor children are covered, but many young working people are left out of any possibility for coverage unless we pass Governor Haslam's Insure Tennessee plan.
Thank you so much for that explanation. Justin, Narcissa, what about your experiences with Insure Tennessee? What have you learned?
Well, one of the things I left out, I think, when I was doing my introduction was why am I passionate about this and what got me involved with this. And so one of the experiences I had was when this bill, Insure Tennessee, first came up before the legislature, being down at the legislative plaza, not even knowing this bill was coming up, really sparked something in me to get active in this fight. When I was at the Capitol, I was amongst people who were in the gap, people who were suffering. I met people like Larry Drain, who's been forced to separate from his wife after 30 years just because she got sick, and people who needed to get just a surgery so that they can get back to work. And so people who are suffering, and to talk to them and just to hear their stories, this is something that really made sense to me. And so when I sat in that committee during the special session, when this was first brought up, and to see this bill killed, and to see just the rhetoric around hating the federal government and not really focusing on those who are suffering in the gap, and then to see this bill shot down, and then to see the legislators walking out and giving each other high fives that they killed Obamacare and we killed this bill, and to see that cruelty exhibited really struck a nerve in me, and that's what really got me involved in this fight. And it's something I come from a family of healthcare professionals, and one thing I said, I'm never going to get involved in healthcare. So it's kind of like a full round circle for me to come back to this fight as a student and someone who believes in advocating for social justice. And this is a social justice issue. And so I guess one thing also to remark is that this year, 1966, 50 years ago from this year, Dr. King made that famous quote about of all the kinds of inequality and injustice in healthcare is the most shocking and inhumane. 50 years ago, we're still having the same fight. And so that's something that as a Fittest student, where we come from a rich legacy of civil rights activism, this is as much a civil rights fight as any fight that I can imagine happening today. So.
Yeah. And Narcissa, I think you might be muted.
The one thing that stuck out to me the most was that everyone was in support who could help push this bill forward, the hospitals especially, and that's the one thing that really stood out to me, because the hospitals were going to cover the rest of the costs that the Insure Tennessee wasn't going to cover. And so the fact that the hospitals were on board, I think that really showed how much of an importance it is to everybody who's involved. And I think that is really important because the people in the rural areas who go to these really small hospitals, those hospitals are losing money because the people don't have insurance to help pay for the health care that the hospitals provided them. So not only will the hospitals be involved and be on board to help cover the costs for these patients, but this will also save the hospitals money. And so I think that was like the major thing that really stood out to me and that I thought was really important.
Yeah, and that actually is a great segue into what we wanted to move into next, which is talking about specific issues like race, class, gender, and how do those show up in connection to the work you guys are doing and the issues that you guys are working with.
Well, can I jump in really quickly just to based on what Narcissa was just saying about the hospitals, and this is very much, we've talked about race, class, gender. There's a major urban-rural issue here too. The Affordable Care Act provides for 100% federal funding for the first 3 years of Medicaid expansion. Now we're already 2 years, we're going to be 2 years in. After that, the federal funding drops down, stair steps down to 90%. So the feds pay 90%, and the state is then responsible for the remaining 10%. Tennessee hospitals have offered to pay the state's share of this, and the reason they're doing this is because there's a law called EMTALA, the Emergency Medical Treatment and Active Labor Act, that requires hospitals, if someone shows up with an emergency in their emergency room, the hospital has to stabilize them. If those people are uninsured, that costs the hospital money. So the more people who are uninsured, the more financial pressure a hospital is under because of the amount of uncompensated care they have to provide. So rural hospitals, particularly very small rural hospitals, have already started to close. There are, I can think of at least 4 in the state off the top of my head, and then the past couple of years have closed. Even a hospital like Vanderbilt Hospital has laid off workers. So whether a hospital is going to close or lay off workers, shrink down, become a freestanding emergency care clinic, there's lots of variations. They might not close, but this is devastating to the economy, particularly in rural areas of Tennessee. If a hospital closes, the largest economic driver in many counties is going to disappear. And how these counties are not going to be able to keep young people there to start businesses, to live in the community, if they don't have a hospital that is that economic driver that brings money into the community and keeps these rural communities alive in many ways, both in the literal sense of making sure that people can have access to health care, but also providing some economic growth in those areas. So this is going to hit, and it is hitting rural Tennessee very, very hard. In many counties, there's not going to be a hospital. The closest place people are going to be able to go will often be 2 counties over. and that is, that's both dangerous for emergencies. Kids are not going to be able to get basic care, even if they have coverage. The lack of a facility is really devastating.
Yeah.
I guess, talking about the issue of the intersectionality between this issue and race and class and geography, we really see that places where our most vulnerable citizens are, these rural areas, are the ones that are being disproportionately impacted. This summer, I was honored to be part of a walk representing Tennessee, where we walked from North Carolina to Washington, D.C. 283 miles to represent 283 rural hospitals that are closing without the expansion of healthcare. And so to be there, to really see the people, where they're being told that, the nearest hospital is 2 hours away, well, the question remains, what if you only have 30 minutes? What if it's an emergency and you only have, 20 minutes and you're forced to drive? This is really a death sentence for many of those people. And about race, too, if we look at the national statistics, 6 out of 10 African Americans live in states that have refused to expand Medicaid. And so we see this sort of, even the rhetoric that's being used, we see, southern states especially using this term of, this is an entitlement program, states' rights. These are racial code words that we heard back during the civil rights movement when they wanted to resist the sort of integration of our school systems. And so, like I often say today, back 50 years ago, we had particularly southern politicians standing in the doorways of schools and universities because they saw people as unequal. Well, today we have Lieutenant Governor Ramsey and Speaker Harwell, our politicians here in Tennessee, standing in the doorways of hospitals and clinics because they see people as unequal, because they see them as politically dispensable. And I say their names on purpose because these are two people who have the power to get this bill to the floor. And so if no one else takes anything else away from what I'm saying, remember those two names, and those are the two people who need to be contacted, are Lieutenant Governor Ramsey and Speaker Harwell, to talk about these issues, to talk about why it is that in Tennessee, we have 24,000 veterans who are uninsured. We have rural hospitals. I think 4 have already closed already. There's about 50 on the list statewide. And so what are we going to do about this moral crisis we're facing in Tennessee?
And just adding to what everybody has already stated, I got, me being a client advocate fellow, I received so many cases from older black women, older black men within the age range of 50 and 40 years old dealing with diabetes, COPD, heart failure, heart disease, all who are all in the gap and live out in these rural areas who can't get to a hospital quickly. And so just hearing all of that and having to tell them that, there's but so much that we can do, and it just upset me. And so that gave me a drive to really become more involved and to research more about what Insure Tennessee is going to do for the state.
Yeah. Any other comments or thoughts on connections to race, class, and gender?
I can add just the African Americans are 17% of the population in Tennessee, but they make up a disproportionately large percentage of the population that would be covered by the passage of Insure Tennessee. I mean, this is a massive positive disparate impact on African Americans in this state who, because of the way poverty is structured in Tennessee, sort of broad programs to assist poverty in this state have a disproportionate impact on African Americans. So not passing is deliberately saying we have something that's free to the state, the hospitals are going to pay for it, so it's not coming from Tennessee state tax dollars, that will give a disproportionately black population access to health care. So I mean, there's a debate going on now between, say, the Sanders campaign and Ta-Nehisi Coates and the Black Lives Matter movement about is the way to address racial disparities targeted racial programs like affirmative action programs or broad universal programs. And I think, both are necessary, but this is a great example of the way broad universal program like the expansion of Medicaid for low-income people, still has a disproportionate impact on African Americans and can address some of the stark health disparities that we see when we look cross-racially in Tennessee at the population.
Justin, did you have a thought?
Just, also just tying it into this socioeconomic sort of discrimination that's going on here is that I'll never forget one of the people in the Gap when we were at the Capitol. He stopped me and just told me that, Justin, this is a fight to show them that we are people too, that we have work. Because what kind of state is it that we live in where we're willing to pay for the health care of our legislators who are part-time seasonal workers and who are there less than half the year, and yet we won't offer that same privilege, that same right to the citizens of Tennessee because of their circumstances. I mean, this is an issue of discrimination based, from the sort of privileged mentality where these legislators are not willing to offer the same opportunities to their own constituents. And so I think that's something that as we go into this election year, as we go to the ballot boxes, is something that people need to be thinking as to why it is that our legislators feel like it should be a right, it should be a privilege, an entitlement for them, but that should not be afforded to everyday Tennesseans who are working. They're not looking for a handout. What they're looking for is a hand up. A hand up out of lives where they're tied to poverty. A hand up so that they can get well and get back to work. A hand up so that they can be citizens to contribute something. And so people are suffering, and I cannot stress that enough. And when he said that it's about us having work, that's what gives me the fight. That's what I see every time I'm at the Capitol, is seeing people from all around the state, of all classes, standing together saying that we are people too, and that our lives matter.
Yeah. And one last thing, I think that sometimes that we often forget that these issues are really separate from us, especially as millennials. And reading about what Insure Tennessee is and how important it would be for people in our generation, and how if we decided to leave out of our fellowship programs, our internships, and graduate and just work 9-to-5 minimum wage jobs because of our qualifications, we wouldn't even be insured people. And so just remembering that, this would impact us too if we were just everyday citizens working a 9-to-5 without insurance. We wouldn't be covered either. And so just remembering that this impacts us as well.
So I guess the last thing too is just when you go, to the restaurant, that waitress who served you, that's someone who's in the Gap. That janitor who cleans your office building is someone in the Gap. That construction worker who built the bridge that you went over today isn't someone in the Gap. That bus driver who drives your children to school is someone in the Gap. These are people who we interact with every day. They're real people. They're our neighbors. They're our friends. They're our loved ones. Some of them are even us students. I talk to some of our students. There's an assumption that every student has health care now because they're under the Affordable Care Act. Well, that's an assumption that their parents have insurance. It's an assumption that they have a good relationship with their parents. I've talked to students all around Nashville in particular who don't have insurance, who are working part-time jobs too and just trying to get health care coverage and can't see a doctor when they're sick. So I guess keep in mind when we go around today, when we go around any day, these are people we're interacting with on a day-to-day basis and who have such vital importance in our own lives.
And if I could add one more thing, I do a lot of speaking on this, and I very often begin by asking the crowd, how many people here have employer-sponsored insurance, which is the largest source of insurance in America? And everybody raises their hands. It's a huge proportion of people have insurance through their employer. And then I say, how many of you get a federal subsidy to help you pay for it? And everybody puts down their hand. This is not true. Everybody within the third largest federal health program behind Medicare and Medicaid is the tax exemption for employer-sponsored insurance. Everybody with employer-sponsored insurance, if your employer pays any portion of that, you're getting a federal subsidy. So everybody with employer-sponsored insurance gets a federal subsidy. Everybody buying on the marketplace is eligible for a federal subsidy. People who are currently eligible for Medicare and Medicaid get federal subsidies. The only people who are not eligible for any federal help, including all of these people who think they're self-reliant, even though they're getting a big subsidy from the federal government, the only people who are not eligible are poor people. People in the Gap are the people who are not eligible for any federal help. And the feds are there holding the money out, and it's the job of our legislature to say, okay, we're going to allow these people to have access to some health care by passing a bill that's going to cost the state nothing. I mean, it's a no-brainer that the poorest people in our state should be eligible for some federal help to get them coverage.
Yeah, and I think pretty much staying with the same question, but just zooming out, you guys have already answered the first part of this question pretty much, but is this an isolated situation, or is it connected to larger structural issues and or national trends that you all see happening? Any thoughts?
Who wants to go?
Well, I think that for me, what I've noticed is that this healthcare issue is happening at the same time that gentrification is at a rise. And so it's very much a situation of survival of the fittest. And I think that's the major thing that I've noticed, that those are the two trends. If somebody is not being pushed out of their neighborhood, they don't have insurance and they can't get help and they can't get better. So
I think many legislators have been very straightforward about it. The reason that they're not passing this is because Obama passed it and they don't like Obama, and they'll think about it once there's a Republican in the Oval Office. I mean, it's pure politics, and it's it's really the sort of lowest level of all of the people of this state are just fodder for our political games. So I mean, I think there's no way to really underestimate how much the Tennessee's Republican Party's hatred for Obama plays a role in this.
Yeah. And like for me, I've characterized it not even because this is not an issue of left or right. This is an issue of right or wrong. What we're seeing is in 2010 we had this movement. I won't even call it Republican because the Republicans are people like Senator Briggs and Senator Jackson who are supporting Insure Tennessee. Republicans like Governor Haslam. We have these extremists in our legislature who are part of this movement where they talk about taking our country back. And I think that we should believe them. They're taking us back to a time that we don't want to go to. The very same people who are denying health care, denying living wage jobs, are denying voting rights. So we see this trend of regression. So it's part of that national larger trend. If we look at statistics, as I said, 6 out of 10 African Americans live in states that have refused to expand Medicaid. They're trying to make this healthcare issue, this issue of the states versus the federal government. It's an issue that we've heard about, back during the civil rights movement. Anytime there's an attempt to progress, we have these southern states in particular, and not just southern states, but Wisconsin. We see this going on all around where they're refusing to ensure that people, because as Chris said, it's a political issue for them. They're placing politics before people and partisanship before the general welfare of their constituents. And so I guess what we really need to do is we need a movement to counteract these forces of regression, a movement that says that our Constitution in Tennessee in particular talks about the common good, about a government instituted for benefiting the downtrodden, the least of these. And so it's really about taking back that language and seeing that at the legislature we have to have people's presence down there, because for too long we've allowed these extreme forces to take control of our political system here. So
I really am interested in this, what you just mentioned about reclaiming the language, and I'm interested in hearing experiences from all of you and how that kind of reclamation process has had to take place in order to do your work versus the very established legislative language that kind of has its own ways of operating. Any thoughts?
One of the words that I know that we've used a lot, all across the state, there's a movement of people from East Tennessee, West Tennessee, black, white, of all social economics, is the language that this is a moral issue. And you don't really often hear that from our side, this moral language, because we've allowed these forces to kind of take the moral platform. We allowed it to restrict them, to certain issues. Where we're saying that, these legislators who are attempting to pass the Bible as a state book, for example, are obviously not reading it. That they're not reading, where you don't kick people when they're down, where you love your neighbor. Taking back the language, even in our own Constitution, and reminding them of their oath It's not to the Americans for Prosperity and the Beacon Center and all these special interest groups, but it's to your constituents. You take an oath to not do anything that's against the interests of the people of Tennessee. This is what they swear to do. And so we're trying to take back that language and to really take back the people's house. I think that's what is the most powerful thing about this movement to me, is that we were just at the Capitol last week during the governor's state of the state, and to see everyday people coming together and finding their voices. This is really about, as Dr. Cornell West talked about, if you want to hear truth, you have to allow suffering to speak. And so every time I hear people like Larry Drain or Tracy Foster, who's battling cancer right now and who's still uninsured, or Michelle Ardan, who lost her daughter to this, that truth is what we're bringing to the places of power, we're bringing to legislators. So it really is about creating a movement and allowing people to find their voices and to change the language that's being used down there, that we don't have to, we can't afford lobbyists, and so we have to be our own voices and our own representatives down there.
Any other thoughts? Or back to the question of national trends and intersections with race, class, or gender. All right. Well, I would like to ask you guys, as we talk about these very large kind of embedded systems, how do we address systemic issues? Like, what concrete action items can we use to address such large, seemingly insurmountable forces?
Raise your voice. Call your legislator. Call the governor. Call your neighbors. What I think the people who are opposed to this want is for us to go away. They want us to be quiet, and we're not going to let them do that. We cannot force this through. We're not legislators. They're supposed to be acting for us, and we have to let the Tennessee the Tennessee General Assembly hear from people who want this done, the people that be representing. You can call them every day. Just tell them, I'm calling you again. I'm in your district. I want you to expand. I want you to expand Medicaid. I want you to pass Insure Tennessee. That's the most effective thing that's going to happen, is to raise your voice.
Any other thoughts?
Ditto, definitely ditto what Chris said. Is we need people to keep speaking up. What we're seeing in the past week, for example, we've had 3 counties in rural Tennessee pass resolutions in support of Insure Tennessee. That was Cott County, Ray County, and one more county that I'm forgetting right now. But we're having all these local governments, Republicans and Democrats, independents, passing city resolutions saying that we have to put our own people in our county above these political issues, and so that's why we're supporting Insure Tennessee. But more so, I think even in that, we're trying to talk about the systemic issues, is that we as people, I think we need to get into the business of movement politics and not necessarily always focusing on electoral politics. No matter who's in the Tennessee legislature, we have to uphold this fight. We have to say that these are our priorities as people in Tennessee, and not allow the political, dictates confine us, or even define what our movements are about, or our limits. There's been so often people who said that this issue, just give it up, wait till the presidential election's over, wait, Ramsey said there might be a Republican president, they'll give us a block grant. We have to let them know that that's unacceptable to us. Each day, each year we wait is another, time that our neighbors have to suffer, and so we have to redefine the politically possible. We have to redefine political timetables and not just allow these outside forces to define them for us. And even in terms of Insure Tennessee, calling our legislators, but also being there, maintaining a presence, whether in your local county, going, organizing town hall meetings, organizing rallies in your town square, organizing meetings at your houses, bringing the movement from the Capitol to your local communities, and really spreading the word and letting people know that this is not an event, this is a movement, it's not a moment in time, but this is a mass movement of people from all around the state, all walks of life, all demographics. I mean, never before in my life would I think that I'll be standing alongside such powerful warriors from East Tennessee, Northeast Tennessee, who walk through 5 counties, Ms. Pam Weston, or people who hired Northeast and Ramsey's district, picketed his auction. I mean, we go to Memphis and we see people doing, similar actions where they're organizing in churches, and we come here to Nashville and see, all people of all denominations coming together for prayer vigils and having sit-ins at Speaker Harwell's office. This is a really something that I'm just so humbled to be a part of, and it's a movement of people. It's not just Governor Haslam's movement, it's not just a political movement, but this is really a movement of everyday people, and it's the people's history of this movement that needs to be shared too. So.
Mm-hmm.
Any thoughts?
I'm sorry. If I can just, if you want to find out some of the ways to participate, and for sure you can come up with your own, organize in your own places, but one place where a lot of these events are announced is you can follow the Tennessee Justice Center on Facebook. We do announce if we're having actions at the legislature or in other places around the state. I highly recommend going to the legislature and letting Justin lead you in some chants, making sure your voice is heard by those legislators inside the hall. So it's the Tennessee Justice Center's Facebook page, or you can look at our website at tnjustice.org to get more information about some of the organized events that we already have. And if you have an event, please let us know. We can help you publicize it to make sure other people in this activist network know about it.
Great. Thank you for offering those resources. Moving towards the end of our conversation, I want to move back to you guys who each have a unique position in this movement, and I want to hear about your personal experiences and what have you seen in your work that gives you hope, and perhaps also what have you seen that makes you feel despair.
Being in my position, I'm coming from Greensboro, North Carolina, by way of Philadelphia, so I am not a Tennessee native. So coming into this, it was more of observation and taking in and talking with clients about their specific issues. And I think what makes me hopeful is the consistency that I've seen. There has been such a strong consistency in following up and refollowing up, and a really positive aggressiveness that's taking place here with this movement and other movements here in Nashville. And so seeing that makes me hopeful. What makes me or what caused me despair is the fact that I know that the people who are opposing this are very powerful people, and the chances of them succeeding again are significantly higher than the people who are voiceless winning. And so that does cause me a bit of despair, but knowing that people who are voiceless are becoming voiceless and are becoming consistent and aggressive, that's what gives me hope. And so, yeah.
Anybody else?
I'll just point out that the Medicaid Act was passed in 1965. The last state to pass Medicaid in their state, and this was a state option. No state has to participate in Medicaid. The last state to participate was Arizona, which was in 1982. So I think there was a time when Medicaid was first passed that there was the question, are states going to do this? Are they really going to do this? Is it just going to be in the big blue states, California and New York? And, but eventually every state realized this is right for our citizens, this is right for our budget, this is right for our medical infrastructure. I think eventually Tennessee will do this. And what gives me despair is the suffering that goes on while we wait. That there are people like Larry Drain and Tracy and all of these people that Justin mentioned who right now are uninsured, right now cannot get treatment, and hundreds of thousands of more like them across Tennessee who continue to suffer while our legislators sit on their hands and do nothing. So they need to act. We'll do this eventually. Right now, the federal funding is going down, so it makes sense for us to do this now, not next year, not 2 years, both for financial reasons and to end the absolutely unnecessary and pointless suffering of so many Tennesseans.
Definitely, and I guess along the same line, that's what would cause also what caused me despair. That's exactly what causes me despair also, but it's also what gives me the fire to fight. Because until that suffering ends, we have to raise a moral dissent. We have to say that if nothing else, that in the face of so much injustice, that there will be a witness for justice. In the face of so much hurt, there will be a witness for love and for compassion. And so, I guess what gives me hope about this fight is that we have already won. And I say that because to me the victory lies in our resistance to this blatant abuse of power going on at the legislature. To see that despite committee voting it down twice, that people are still fighting, people are still standing up. And that's kind of the battle cry that I've been hearing at the Capitol lately. It's to stand up and keep fighting. And so I guess that's the powerful thing about what's going on right now, is that no matter what the political forces say, no matter how much they say we must wait, people are giving these reasons as to why we cannot wait and why we will not wait. And that I guess as Fannie Lou Hamer said, that move on over, we'll move on over you because we're moving on. And so that's the same thing that I'm seeing with Insure Tennessee, is that people are moving onward, that despite the governor not even mentioning Insure Tennessee during his State of the State, people are saying that we will give our own state of help in Tennessee. We will travel to our local counties and share this message as to why we have a crisis when it comes to healthcare. And so regardless of the forces that we're facing right now, as the song goes, we ain't gonna let nobody turn us around, and we shall overcome this, because we have it's a small minority who's blocking this. That's the thing that we have to remember too, is that if this was taken to the floor, we really think that this would be passed. And it's a very small group of legislators. It's not the majority who's opposed to this. It's Republicans, Democrats supporting this from both aisles, coming together saying that this has to get done. People in rural counties saying that we need this because our rural hospitals are going to close. People in the urban areas saying that we have a disproportionate amount of uninsured that need this. And so it's a small group of extremists, people like Ron Ramsey, Speaker Harwell, Brian Kelsey, Dolores Gresham, Mike Bell. I'll name them because these are the people who need to be contacted and called out on what they're doing, because they're putting people's lives on the line. They're allowing people to suffer and this needless suffering, and so they need to be called out. And so I have hope that we'll win, and it's not a matter of if, but it's a matter of when.
Thank you.
About Jeremy Durham.
Jeremy Durham.
Well, thank you guys so much. This was a very informative experience for me, and it's really neat to see the different faces that work in this movement, as I'm sure that is great for our viewers to see as well, the many different ways you can be involved. To our viewers, please feel free to share this video and join us next time. To keep up on what's coming next, make sure to follow us on Facebook and check out our website at scarlettbennett.org. I just want to thank our wonderful panelists again for being here and putting so much energy towards a very important cause. Thanks.
Thank you.
Thank you.